Hello, and welcome everyone to this Google Plus Hangout with Girls Globe. We are so excited for the new year and to continue our conversation on the importance of maternal and newborn health. This is a series that we've been doing since last year, talking with individuals and organizations about the importance of motherhood, the importance of maternal health around the world. And we've had some really engaging conversations with organizations and leaders and health professionals in the field. My name is Diane, and I'm the Vice President of Girls Globe. We are an online magazine and global network working to raise awareness about the health and rights of women and girls around the world. I'm so excited. Today we're joined by the Kupona Foundation, and they're working to improve maternal health in Tanzania. And I want to encourage those of you watching online and those of you who are participating online to ask and tweet your questions to using the hashtag #GGHangout. During this conversation, we'll be taking your questions live, so if you have a question, definitely ask it, and we will direct those questions to our panelists. You can also ask questions using the comment box in Google Plus Hangout. So if you have questions, I do encourage you during this time to ask those questions, and hopefully they will be answered during the course of this Hangout. Without further ado, I'd like to have our speakers introduce themselves and in about 30 seconds explain what you do, and we'll start with Abbey for that.
Thank you very much, Diane, and thank you so much for having us with you on Girls Globe today. Girls Globe is a great supporter and proponent of the causes that we support. My name is Abbey Kocan. I am the Executive Director of Kupona Foundation. What I do? Well, presently at night I wake up every 2 hours with my 16-week-old baby, so please forgive me if I'm slightly less articulate than I normally try to be. And during the day, I have the pleasure of leading a very small team at Kupona Foundation to improve access to quality healthcare in Tanzania. We do this by working directly with our sister organization, CCBRT, in Tanzania. They're really the stars, and we're super fortunate to have Dr. Brenda M'bello with us today from Dar es Salaam. I do a bit of everything as an executive director of a small team. I work with our donors and supporters. I work with our foundation and institutional partners. I get to travel to Tanzania and do early morning Skype calls, and I feel very fortunate. I love what I do.
So my name is Dr. Brenda, and I'm the Tanzanian counterpart of Kupona. So I'm an OBGYN that works for a Tanzanian NGO called CCBRT. And this NGO is 20 years old. Its core business is preventing and treating disability. And over the last 6 years, it has expanded into maternal health, recognizing that using the maternal health platform is a good way to early identify disability and treat children born with disability, as well as prevent disabilities like fistula. So I work in the big city in Tanzania. It's with a population of 4.5 million. It's called Dar es Salaam. And I support the local government to improve the quality of maternal and newborn care at 22 government facilities. These in total do on average 80 to 100,000 births a year. And I'm also part of a project team that is building a new maternal and newborn hospital that will contribute to strengthen the health system here in Dar es Salaam and absorb some of the high-risk cases and contribute, we believe, to decreasing maternal and newborn death.
Well, Abbey and Dr. Brenda, we are so excited that both of you are here with us today, and excited to have this conversation with both of you. One of my first questions that I want to throw out is first directed to Dr. Brenda, and that is, what do you see as the biggest challenges facing healthcare professionals in Tanzania today?
So, so that is a very nice question, and it's also very broad because in developing countries like Tanzania, there are so many challenges. But I would say that the greatest challenge that we have after 6 years and so much of investment and multiple donors interested in the maternal health space is the shortage of skilled human resource. So we have a shortage of numbers of hands on the ground that are available at the present, and we also have like for the next few years, this shortage is not going to go away because the training institutes are also overwhelmed. So they lack capacity and they don't even have enough enrollment. So we've got a big problem that really will need a lot of effort and will take a couple of years to get on track. So if the data shows we have only about 56% of the skilled human resource we need, which is about four to seven health professionals for 10,000 population. That really, I mean, the number of doctors is like a fraction, point something per 10,000. So it's really, sometimes I describe it like trying to make a shilling out of 50 cents. You know, it's really, really the human resource shortage is critical. Yeah. So,
and Diane, I would just add to what Dr. Brenda said. I think that is definitely the biggest challenge faced. Recently in November, my colleague Samantha and I attended a speaking engagement by Dr. Paul Farmer from Partners in Health, and the thing he often says is staff, stuff, space, and systems. I think that's the broader context. I think what Dr. Brenda said is absolutely probably the largest challenge, but without also addressing the space constraints, the access to stuff that you need to actually provide high quality care, and then strengthening the broader healthcare system. Those are critical components, and I think that is the work that we support with CCBRT. Dr. Brenda mentioned she works with the government of Tanzania. That's a really important piece that we shouldn't disregard, because working within the system to strengthen it will do a lot more for future generations than simply working within a silo and focusing on one component. So it's a complex challenge, but we know how to solve it, and I think we're doing the things that need to happen to see improvements, which we have.
Wow, that's certainly, it sounds like an overwhelming task when you think about it, but I think that it's encouraging to hear that things are being done. So when you think about, the standard of care in the U.S. and then the standard of care in Tanzania, and Abbey, you've recently become a mom, so you have personal insight into this as well. So how do you think that compares, and what are some examples from your own work? We can start with Abbey for that.
Yeah, thanks, Diane. Yes, I have very recent experience, and I will say that the work that we do was in my mind pretty much the whole time that I was going through my birth experience, which is maybe a slightly unique perspective to have. So I think that there are differences in experience and expectations that we have in the United States and a lot of developed countries as opposed to Tanzania. My experience, I went to the hospital. We had our own room. My husband was with me the whole time. I had constant fetal heart rate monitoring. When there was an issue detected, when my son's heart rate started to drop every time I had a contraction, I had the full attention of 2 nurses and a doctor at my side for over 2 hours before they decided that we needed to do an emergency C-section. That then happened very quickly. I had already had an epidural. We went into surgery, and within a matter of minutes, my son was born. And he had the umbilical cord wrapped around his neck, body, and leg, which is what had caused his distress. So again, I was very aware of this the whole time. Had I been in Tanzania, most likely I would have been laboring in bed with 2 or 3, if not more, other women. We've said that for a long time. I did not understand what that meant until I was in labor. And I did go without pain medication to try to get some understanding of their reality, of the women in Tanzania. And I can't imagine doing that at this point. They would not have had constant fetal heart rate monitoring. It would have been intermittent at best. And that, again, as Dr. Brenda said, is largely due to not having sufficient numbers of staff. So even if they're perfectly trained, how do you monitor 5 women in a bed to understand if there is any distress? I had a healthy pregnancy. I would not have been identified as a high-risk case. So likely in Tanzania, my son's distress would not have been identified. If it had been, it would have taken several hours probably for the staff to get together, to get the supplies that they needed, and to do the surgery. At that point, and this is something that really, I've gotten past it a little bit now, but was very upsetting to me at the beginning, my son very likely would have been stillborn. Regardless of me having had a healthy pregnancy, that would have been the most likely outcome. And so, yeah, it's a lot different. And I think going in also, my expectations were that I would come out with a healthy baby. I had ideas for names, and Dr. Brenda maybe can speak to this, but I think in Tanzania, women don't tend to name their babies until some number of weeks, if not months, after they're born, because the likelihood of the baby not surviving is so high. So maybe Dr. Brenda can add to that a bit.
Yeah, so I think Abby's experience is what we're striving for. So I think I really like the way she put it, is that the expectations are completely different. So women in Tanzania expect, much less. When she talks about having a baby 16 weeks ago, I had my first baby 18 years ago. So it was a long time ago, but I still remember. I was, an OBGYN resident, but months before I had my checklist. I had my emergency pack ready. I had a little tray that had a little checklist that if I lose consciousness, do this. If I have a fit, do this. I had the numbers of all my friends that I could call. I had sterile gloves. And then because I was a doctor and I knew all the people in the place, they put me in the high care where they keep all the fitting women. So all the women around me were sedated. So there was one clean bed with a sheet, and I got a bed to myself. And I had my little tray that was written there, Dr. Brenda's. I had already donated 2 units of blood that I was refreshing every couple of weeks so that I had a stock of blood. It was a lot of effort. I had to, and when they wanted to give me a painkiller, I said, please don't, because I want to see what you're doing. So I wasn't completely confident that they would, I wanted to know every minute what they were doing. So, but it was amazing because it was a 2-hour labor. It was really easy, and we kind of don't expect anything different. It was good, and it's a distant memory. But what I do wish is I would like the women in Tanzania to have an experience and not have to worry and be so anxious going into childbirth, because it is their right to have a safe birth. So they just need to pick a clothes and start decorating a room, which we never do. We don't even look at baby names, because it's like, what if you do a baby name and then you don't get a baby, and it's so traumatic. So I feel that's what we're trying to do, is make sure that I was lucky I was a doctor. I had influence, and that was slightly in my favor. But it would be nice to have it like equal. Everybody has access to safe care. Yeah.
Wow, it's so, thank you both for sharing such a personal and powerful perspective, not only on what care is like both in the U.S. and in Tanzania, but also, what that really means to you as mothers. And, I think we can't fully understand until we experience something ourselves. And so, Abby, like you said, you had options and care available, but the outcome would have been so much different in a different context, where there aren't as many resources available for that care, or the care cannot happen as quickly as it needs to. So what is Kupona Foundation? I'd like to dig a little bit deeper into what Kupona Foundation is doing to tackle the maternal and newborn health care. I would call it a crisis in Tanzania. So Dr. Brenda, if you want to speak to that first, and then Abby, you can also fill in as well.
It's Abby's baby. Let me give Abby a chance to go ahead and tell us what she's doing.
Yeah. Okay. So Kupona Foundation, and I'll talk more about details about what we do, but if we start with the fundraising component, We fundraise to raise funds. We also look for in-kind donations, and we do plug some critical resourcing gaps with technical advisors and connections to expertise in the United States. But for the maternal health care crisis, what we're focusing on is really enabling CCBRT. So I will start, but I will then kick it back to Dr. Brenda. So it's enabling CCBRT through healthcare worker training, infrastructure development and investment in infrastructure, and what that means is improvements of the government's healthcare facilities where we're working. So if you think of the healthcare system in Dar es Salaam, this is similar to in the United States in some ways as a pyramid. You start with the lower levels of care, which is where a normal delivery would go, and then you refer up as you have complications to a higher level of care. We are building, as Dr. Brenda mentioned, a 200-bed referral hospital for high-risk cases. So that is a critical component because it's increasing the numbers of beds, it's increasing the number of trained healthcare providers who can provide the necessary services, including things like access to blood. Hemorrhage is a leading cause of death for mothers in Tanzania, and not having access to sufficient blood banks is an important piece. At the same time, if you don't strengthen those lower levels of care, we would find ourselves in a similarly overwhelmed state when we open the new hospital, where we have too many women. So this is where the work that we've been doing for the past 10 years is so important. So I think those are, I mean, really for Kupono, it's fundraising, so we're looking to find like-minded donors and institutions that can support our work, and then also helping to fill some of those critical resourcing gaps in Tanzania that Dr. Brenda and the team at CCBRT identify. And we work really side by side with them. We talk weekly, and it's, I think, a very unique relationship. Dr. Brenda, did you want to add to that a little bit in terms of the actual maternal health care work in Dar?
Yes, so my work is more in the field. So currently I work directly supporting the 22 facilities that are conducting deliveries, and we do a comprehensive package. So we do right from antenatal care, strengthening care in labor, we do anesthesia, and we cover a lot of training. We do a lot of training of managers, we do system strengthening, data strengthening, audits. So we build the system up very slowly, and everything we do is done by a joint team. So we're really trying to strengthen a system, and we've seen some promising results. What I must recognize Kupona for is that they listen to our needs, and they are supporting and they're working along with what is needed on the ground. They also helped us with a technical advisor that was really great to have, like extra hands on deck, that came in and taught surgical technique, and the kind of our approaches, we train trainers and then we try and cascade it, and it's my last maternal audit, we still got reports that we're using this technique, we're doing a special B-Lynch suture that was taught by the technical advisor and saving lives. So even something as sending one skilled person for a duration of a year has left a legacy of a skill that is continuing to save lives. And so I really do appreciate Kupona.
Dr. Brenda, I'm wondering if you can share maybe a recent success story of care provided to a woman, or how you've seen conditions improve for women. Is there a story that you can share with people who are watching?
Yes, I can. I mean, this is something, 3 times a week I do go to the wards, and one of the things that it is important to recognize the linkage between the organization I work for, that is one of the largest fistula providers in south of in Africa, and the work we do, because a lot of our fistula, which is a condition where the woman has a long labor and it's blocked, and then the baby obstructs, leading to some kind of a damage of the genital tract, and then she leaks urine or feces. So that is a very disturbing and disabling condition for a woman. And we see CCBRT does about 800 surgeries a year, some on site and some through its outreach. So when we started our program, the standards of care were like about 5%, and it was completely and overwhelmed how system, and about 25% of the fistula we were treating at CCBRT was coming from the catchment area. And this is an urban area, so where people sometimes think that you do not get fistula in an urban area. So we've been improving the system very slowly over the past 5-6 years now. And a couple of Mondays I went on a round and I saw this little girl lying on a bed. And she was so tiny, she was only 15 years old. And at that time, you know, for me, when I see 15-year-old, very pregnant, all the alarm bells ring, because I see I've very often had to review that case, either in CCBRT in the fistula ward or in a maternal death review. So I go on full alert, and it's just instinctive. And I looked at her, and she was the same age as my daughter. And I told the ward round, I said, this could be my daughter. You know, what are we going to do? And she was scared. She was alone. And they said, don't worry, we've got this. And immediately I said, you know, I really want to, everything we've done, let's just, you know, go large. So it was really wonderful to see that they allowed her aunt to come in. She was an orphan, so she had an aunt, and they brought her in. We, you know, examined her, and she did not want a cesarean section, and she was completely afraid. Now, ordinarily, she would have been left alone, so if things went wrong, we wouldn't have been able to monitor her. But she was allowed to go into labor. She was induced, and the next day delivered a healthy baby. It was a baby girl. And so it was, you know, 5 years ago, that would have been a tragedy. And right now, you know, someone like, it was a complete success story, and it was so wonderful to see that it is possible. And, you know, and one by one, we're going to win life for all our women. Yeah.
That's so, yeah, go ahead, Abbey.
I just wanted to mention one thing that Dr. Brenda mentioned, or point to one thing. In Tanzania, in the U.S., we almost always, you'll see, we have a birth coach with us, which could be a husband, a spouse, a partner, a parent. And what Dr. Brenda mentioned about bringing in her aunt is something that's still unique. And Dr. Brenda often speaks to respectful maternal care and how important that is. And I think, again, it's something that we take for granted. We assume that we will be treated with respect. We think it's our right that we are treated with respect. And that's something that this success story is so great because this girl was treated with respect, and the staff around her knew what to do. And that was not the reality 10 years ago when CCBRT started working with the healthcare providers that they are. And again, it wasn't for lack of people trying or wanting to do the right thing. It was numbers, it was training. And so again, I think that's just such a special story because this is something we're working toward, and it's great that it's already starting to happen.
Yeah, that's so so encouraging. And Abbey, I'm wondering, what would you say? You know, we're hearing from Dr. Brenda, and I would say that that story is such a proud moment in seeing the shift from quality care being provided and actually seeing that actually happen and take place. But what's a proud moment for you since launching programs in Tanzania and just even working with Kupona Foundation?
So in terms of the work on the ground, one of my proudest moments was a success story we told. And again, I mean, the pride goes to the team there. We tell the story. I did fail to mention that. One of the things that Kupono does is to help tell the story and raise awareness, which is what we're doing today. So that is another thing that we do, is to help people understand the challenge. So one of those stories that we told just over a year ago was the story, or I guess over the past year, of Temeke Hospital, which is one of the district hospitals, which had historically had one of the highest maternal mortality rates in the region, and they had 2 consecutive months with 0 maternal deaths. And that may not sound like something big, but when you think about, you know, 0 versus the numbers that can get quite high, each person, the life of a mother, we talk about the life of a mother a lot, and the life of a mother is important because it has an impact on the broader family as well. It's not just, if you lose the mother, the entire family is likely to not have as good access to education, to be less healthy, to be in a worse financial position, so they're staying in poverty. There's a ripple effect when you lose a mother. And we talk about that a lot. So I think that that success story of 2 consecutive months with no maternal deaths in this large facility is amazing. So that was one on the ground. For Kupona, I think I'm just, I'm proud that we have now a small team. We are a small organization in the U.S., and I think we've been able to really expand our reach and start to tell our story, because it is really a compelling organization to get involved in because of this direct relationship we have with Tanzania, with CCBRT. And I'm just proud of the team for growing, and I think keeping things moving forward so that I was able to have a maternity leave. So I'm still coming back from that.
Thanks so much, Abby. We do have we have a question from those participating online, so I want to interject because it fits with what we're talking about right now. But so the question is, what are some of the interventions you've done that have had the largest positive impact on maternal health results in Tanzania? So I don't know if Brenda, you would like to speak to that first, and then Abby, you can chime in as well.
Right. So one of the things that what we have learned is that to impact maternal health, we can't do just one thing. So the area, when we started in the field, there had already been a lot of work done in the antenatal, but the care in labor was a little bit poor. So what I feel is really important about the approach we've used a standards-based approach. So we have looked at strengthening the skill and training healthcare providers in how to recognize emergencies and how to manage it. So we've increased their competency in managing emergencies, and it is actually these emergencies that cause the loss of life of the mother and the baby. Just like Abby said, it's recognizing the fetal distress. So we have done a lot of training. We train about thousands of healthcare workers every year, some in longer courses, some in short courses, some on the job, but that's the core of what we do. And we cover almost all the topics that are necessary, including resuscitating a baby. We also go into basic life support. Over the years, we've also done training in anesthesia and surgical skills using the WHO safe surgical checklist. What we are looking at and what works is that when you try to train them on anything, it is good to agree on the standards. So agreeing on the standards is a way of engagement in the new protocols or the protocols that you want to use, and creating a team that will then implement it. So it's not a one-sided. The people who are doing the job are actually engaged in the assessments and in the training, and that seems to be really working. And we cover a whole host of interventions, right from the antenatal care, right and to the community. So apart from anesthesia, we invest in equipment, supplies, whatever is needed to make sure that they can provide the services that are needed to save life. Bearing in mind that the health budget is grossly inadequate. So Tanzania, the government fully pays for maternal health care. So maternal health is free for all women at the point of service, which is really a very generous thing for a poor country. So there is no barrier for women accessing health care. But as a result, very often there's a gap in supplies and repair and building new infrastructure. And that's where organizations like CCBRT come in. We are partnering with the government and helping them move along an initiative along the lines of a national strategic plan. So one of the things that we have also invested in is the community, because impacting for a very social community like Tanzania, just working the health facility is not enough. So we educate the community and get them to come early, educate them on danger signs, how to recognize the baby's sick or the pregnancy is not going well. And we use innovative ways like theater groups that go around and drama and sing and collect a crowd and educate the community. So we do the whole spectrum. What I feel is really important is to have standards and to engage the people who do the work in the implementation of the work.
I don't know that I have that much to add, except Dr. Brenda gave very specific examples of things that are happening. And again, I think in terms of just the highest level intervention, it is the investment and focus on integrated care and working with the government of Tanzania within the system to strengthen it, and also working very closely with the community to build that trust and to educate not only healthcare workers but people in the community as well.
Great. So what would you say is the future of healthcare in Tanzania? You know, we've had this past year, we've had the launch of the new Sustainable Development Goals, which has sort of set a global framework for a variety of targets, including healthcare, over the next 15 years. But for both of you, what do you see as the future for mothers and babies in Tanzania? Abbey, we can start with you and then go to Dr. Brenda.
Sure, absolutely. So, I mean, I think simply it's high quality integrated care for all mothers and newborns in Tanzania with higher expectations for respectful care. I mean, I think that would be what I see as the vision. Dr. Brenda is closest to it. I have not been in Tanzania since last March. And related to the Sustainable Development Goals, I think I was quite busy at that time. That was the week my son was born that they were released. But with going from 8 Millennium Development Goals to 17 Sustainable Development Goals, my hope is that the focus is not lost on mothers and newborns, and that we can maintain that focus to achieve that vision. Dr. Brenda, did you have a different vision, or did you want to add anything?
Yeah. So in terms of what I desire for the women of Tanzania is that, in very simple terms, that they will have like a clean, compassionate care at the time of birth, which is delivered by a competent, compassionate care provider. And that's very, very simple. What I feel about the Sustainable Development Goals is that they're fantastic, and they address what is contributing. Like, they address the contributing cause of maternal death, because if you really look back, an educated population, there would be less death. If we had less poverty, there would be less death. So it is great, but I am a little bit skeptical given the big, Safe Motherhood Initiative, and the, we've always come up every couple of decades. We come up with a big initiative, and it's so much of material written and spoken, and on paper and published in magazines, and it takes a long time for it to be translated into compassionate care for the healthcare provider, because it's really, I mean, there's a lot of investment at the top, and there's not enough investment on the ground, right where the patients need it. And I hope that this time it will be different, that we will learn from the past, because the last 5 years of the MDG, there was this rush to accelerate, achieving the goals. I hope we take our time and we really work this, because any one of them, if you do education and get it right, it'll impact maternal health. If you do poverty and get it right, if you do infrastructure, if you do clean water, it'll impact maternal health. But most of them, it just sits as interesting goals that people will write essays about, and there'll be very little donor investment on the ground. So I hope that doesn't happen this time. Yeah.
I think you touched on a key point, Dr. Brenda, and that is things take time. And one thing that just impresses me about so many organizations who are doing great work is that you're taking the time to have that investment and have that cross-cultural partnership and relationship between Kupona Foundation and the work on the ground. And so I just think that's such it's a model that works, but it's not always a model that produces fast results. And so I think one of the things that especially donor communities need to understand is it does take time, but it's going to be it's a better investment in the long term. So that's such a great point. We have one more question from those participating online, and that's in regards to young people. Do you see young populations getting involved with the fight for maternal and newborn health? How do young people play a role in this fight? Are they coming up as health workers? Are they being trained as health workers? What do you see in regards to how young people are involved?
Abby, do you want to have a go at that?
Well, I'm not sure if we're talking about young people in the US or Tanzania or both.
Either one.
Okay.
So maybe let me have a go. So I know the adolescent and reproductive health program is a big focus because even in the Sustainable Development Goals, that's a target. The country is very mindful, the planners are very mindful, so there's a lot of strategies that are geared to engage the young people. What I am seeing is they are far more responsible. So there is some kind of a positive change in the behavior of the youth. However, what would be nice if the young people would choose to go into healthcare, and that's not happening enough. Going into healthcare, nursing professions, and medical profession is still quite hard and not very attractive because the remuneration is not very good for healthcare workers, and the conditions are not satisfying. So they work under very hardship situations. We also have an issue of a science background. So we don't have enough science labs. So we don't have enough science students. So we don't have enough candidates to take science that can become nurses and doctors. So you can see the root cause goes quite it can be quite intricate. But I know that as a country we are looking at engaging and working for getting the youth involved. Yeah.
And I don't know, I mean, in the United States, I think, what can young people do and what have we seen? One is educate yourself on the issues. So even attending things like this, hearing firsthand from Dr. Brenda in Dar es Salaam, Tanzania, about what the challenges are, following or subscribing to newsletters from organizations like Kupona Foundation or Girls Globe that are talking about the issues and things that are happening. I think that helps people identify maybe where they have an interest or a passion that they might want to get involved. And there are lots of different ways to get involved. An easy one is even small fundraisers, types of things that people can do. Fundraising through runs, we have a colleague who did a Kilimanjaro climb and did fundraising that way. Attending events to learn more. I mean, I think these are all things that we have seen and I hope continue because the context is much different, and it's sometimes hard to imagine what that reality is. But again, it's really just happened to have been that we were born in a certain time and place, and other women or children or men were not born in that same time and place, and so the reality could be very, very different. So I think educating yourself is a good way to start.
Well, thank you so much, and this has been such an engaging conversation, and I've loved all the participation happening both online and just right here in our conversation. I want to give each of you just 30 seconds to summarize or pitch anything else you want to say to those who are watching today. So Dr. Brenda, just 30 seconds, not 30 minutes, 30 seconds, and then Abbey, you can close after Dr. Brenda.
So what I must say is that the work I do is, I've said it often, is one of the most heartwarming. It's a really satisfying work, and just going into work every day you go to work is almost a privilege because just one day at work you can feel you make a difference. So it's a really privilege to do the work I do, and I have a very small team, and it's really also they're very passionate, and it's great to see the impact. What I would like to say, I'd like to thank Abbey for trusting us and working day and night to get us funds that we can do more work. I also want to thank Girls Globe for just connecting with us, because I think the work we do is amazing. And if you check out Kupona's website, you can get a glimpse of some of the work we do. It's very tangible, and the results are really visible, and every day their lives being saved. So it is indeed a great pleasure to do what we do. Yeah.
Thanks, Dr. Brenda. And again, I feel very, very honored to work with you all. And thanks again to Diane and Girls Globe for having us. I think very simply, a 30-second pitch, 3 things that you could do would be to donate, for one, to stay involved, or sorry, to spread the word and to get involved. And just to give people a sense, a $65 donation would fund about 1 hour of mentoring and coaching from one of our technical advisors for healthcare workers, and approximately $500 would fund a clean, safe, respectful birth like Dr. Brenda spoke about. You can go to our website, kuponafoundation.org, and see more about how a donation would break down. You can spread the word by sharing this Girls Globe chat, by talking to your friends and family about the work that what you've learned and things that we do. And you can get involved by signing up for our mailing list. There you'll hear the stories that Dr. Brenda is mentioning, which can be very far away. And what we really work to do is to bring those to people so that that's close to you. We also have events in New York City and around the country, and by following us on social media, signing up for our mailing list, you can stay abreast of those updates. But really, it's an honor and a pleasure to do what we do. But we do need our supporters and donors to make it all possible. So, thank you to you, Diane, and to Dr. Brenda for everything you both do.
Well, thank you so much. This has been such an inspiring conversation, and thank you to all of those who are watching and participating online. You continue to follow the hashtag GG Hangout for more inspiring conversations this year. You can also find engaging and inspiring stories from Kupona Foundation on girlsglobe.org. And again, please follow these instructions from these wonderful ladies to learn more about what's happening to improve maternal health in Tanzania. So thank you, ladies, again so much for joining us today.
Thank you. Thank you.
Thank you.